From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Ivermectin will soon be sold over the counter in Idaho. So, what are the implications of this new law? Well, joining us today to talk more about that is Dr. David Pate. He is the former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma, and welcome back.
I was going to say, it has been a while since you and I have been together. My unexpected break from the show after appendicitis. Who knew? So, wow.
Well, it's good to have you back.
Well, I'm glad to be back. Now, folks, remember, if you have a public health question, be sure to send us an email at idahomatters@boisestate.edu. So, Dr. Pate, I want to talk about this new law that Governor Little signed into law, and it will allow for ivermectin to be sold over the counter without a prescription. First off, remind us what ivermectin is.
So, ivermectin is a medication that we have used for a very long time for certain diseases, most of which we don't really see here in the United States, because these are mostly diseases caused by helminths or worms. And so most of the diseases that ivermectin is used to treat occur in countries like Central and South America, Africa, various places like that. And the use in the United States has been pretty limited. We have used it occasionally for rosacea, especially if that's a skin condition involving the skin of the face, if it's not responsive. And we've used it for very severe cases of lice when other treatments don't work. But it just doesn't have a broad range of proven effectiveness for diseases we commonly treat in the United States.
And in fact, Dr. Pate, myself, and I think a lot of other people had never even heard of ivermectin until the COVID pandemic. So remind us, too, how this kind of got into pop culture.
So what happened was at the very beginning of the pandemic, of course, we were looking for potential antiviral medicines that we could use. In the first year, remember, we did not have a vaccine and we had people getting extremely ill. And what led to ivermectin, I think, initially was a report that in the laboratory, when you have virus in a test tube and you put in high concentrations of ivermectin, it did impair the replication of the virus. And so people made the mistaken conclusion that, oh, okay, it works. Well, that's not how it works. What we have to do is there's a lot of things that look like they will work in a test tube, but we have to trial them in humans. And what the immediate red flag about ivermectin and why the overwhelming majority of physicians did not use ivermectin was that the concentrations of ivermectin that were required in the test tube to prevent the virus from replicating were at levels way too high for humans that we knew the ivermectin itself would make humans very ill. So we didn't embark on it, but it soon became a push by anti-vaccine groups as we were now getting into the summer, getting positive results from the vaccine studies. And I think a lot of times what they want to do is give people some kind of medication to take so that they can feel justified in not taking the vaccines. But of course, ivermectin has proven out over many well-done studies to have no effect in either preventing COVID or treating it.
So with that said, Dr. Pate, the fact that this law was signed by the governor and it will go into effect, good or bad idea to allow ivermectin to be sold over the counter without a prescription?
Bad for so many reasons. So here is why this is a problem. So first of all, we now have yet another situation where Idaho law conflicts with federal law because the Federal Drug and Cosmetics Act, which regulates medications, a federal law, and through the FDA, and then as amended in something called the Durham-Humphrey Amendment, um, uh, designates the authority to the federal agency to determine which medications can be sold over the counter, which ones require a prescription. So now we have a law that's in conflict. Well, what does that mean? What it means is reputable pharmacies are not going to offer ivermectin over the counter, even despite this law being passed, because they could get in trouble with the federal regulators.
Hmm.
So the next reason why it's bad is that the legislature, to my knowledge, has not explained its reasoning for getting into the business of regulating, or in this case, deregulating drugs. I am not aware that our legislature has the expertise to be evaluating drugs, and I think this would be Exhibit A. Number two, we don't have the infrastructure in this state to monitor drugs for safety, for reactions, all those things that go into this. We don't have the people to evaluate drug applications. So is this something the legislature is going to get in now and start reviewing all medications, or is it just ivermectin, or are there going to be other medications? And if they are going to get in this business, one would think it might make sense to have doctors and pharmacists testify. And of course, they had none of that. So that's a problem. And then to make it worse, if you listen to or read the discussion among the lawmakers that were touting this bill, their reasons were mostly nonsense. And it was alarming to me that they were suggesting in various comments that that people, you should give this to your kids. You could take it for colds. You could take it for cancer. And basically, that it would be a cure-all, which it is not. It is a great medication, but for a very limited, specific number of diseases. And I think that with all this disinformation, and now what this sends the message to people who are not really following all this carefully is, oh, well, if it's now over the counter, it must be safe. And that is not the case. And especially if you're going to take it like one legislator suggested, like vitamins.
Hmm. It's always interesting to me, Dr. Pate, getting back to this, what you mentioned about the fact that there was no testimony allowed from physicians and pharmacists before this bill was passed, it's ignoring someone's expertise, right?
Exactly.
I am not a doctor. I'm not a lawyer. I'm not a lawmaker. Didn't go to school to become an expert in that. Having just gone through a medical emergency, the place I went was the emergency room. The people who helped me were surgeons, right? That's who I wanted to help me, not someone in the legislature who doesn't have that medical expertise. How frustrating is that for people in your field, or you in particular, when we see this? Because this is not unique to Idaho right now.
No, and what I've tried to explain is that this fits into a larger picture. And I'm glad how you characterized it, kind of anti-science. But what this is doing is, together with a whole host of other things that the legislature has said, the legislature has done, is we're creating an increasingly hostile environment to medicine and to physicians. And what the conflict is that on one hand, the legislature is saying and acknowledging that we do have a physician shortage here in Idaho, one that the legislature has already said does need their attention. In fact, they are now embarking on a decision as to whether to buy a medical school or not. Because they want to solve this. And the point that I've made to them is that, buying a medical school is not going to solve the problem. And if you keep on rejecting science, giving people who are spreading disinformation preferential access in the Capitol and to their voices without the voices of science and reason, if you are passing all these laws that are making it more difficult for physicians. And physicians are the ones that are going to have to treat the problems from making ivermectin over the counter that I don't think they've given much thought to. What we're doing is we're saying one thing, we want more physicians to come to Idaho, but we are doing things that will make physicians not want to come to Idaho.
And I think it's important to say that, well, look, doctors aren't fallible, right? I mean, they are fallible. They are human. It is the practice of medicine. You have the right to always get a second opinion, a third opinion, as you should do. Advocate for yourself, advocate for your loved ones. But Dr. Pate, there also comes a point where when, the vast majority of physicians are saying the exact same thing, right, based in science.
Yes.
When do we, need to start listening to these, medical professionals? Again, I mean, advocate for yourself. I think that's really important.
Right. And I would even go further, Gemma. I think that competent adults have the right to make stupid or foolish decisions. That is completely up to them. It is, and I think it's fine for them to be misinformed, misled, whatever. If they want to fall for some false line of marketing or talks and all, and they want to do something, that's fine. What is the problem that is really bothering physicians is that we have people that express credibility, doctors or related healthcare professionals. We have legislators, et cetera, that give validity to what is clearly disinformation. And what happens is at the beginning of this pandemic, we had patients coming to the hospital critically ill, and the families were finding out they had COVID, and they were in shock and disbelief because that family member was taking ivermectin, and they had listened to doctors who said it is 100% effective. You can take the ivermectin, you're not going to get sick. So how is it possible that their loved one is needing to go to the ICU and might die, and in some cases did? And it breaks doctors and nurses' hearts that these families have been misled. So I think that, look, you give people, my belief is we give people the facts. If you don't want to get vaccinated, don't get vaccinated. If you don't want to take a medicine, don't take a medicine. But as long as you have the facts. But what is really tough for us to accept is when people are purposely misled and then it harms them. That is really hard for physicians to deal with.
Dr. Pate, I want to talk next about this growing measles outbreak. Where does it stand right now? Because I know I've been off work for the last couple of weeks, but I believe in that time, another child passed away from measles down in Texas.
You are exactly right. An 8-year-old child, which is just tragic, and this is also a great example of what we were just talking about when people say, well, what's the harm of ivermectin? Well, the same thing happened with measles, with people at some of the highest levels of our government suggesting vitamin A. So now doctors in Texas are treating children that are critically ill with measles, but also having vitamin A toxicity and liver damage. So it's not helping, and it's actually hurting people. But you are quite right. We had another death. We've had a continued spread of the measles now to more states with having cases. I firmly believe that we're not going to get this outbreak under control anytime this calendar year. I think it's going to continue to grow and spread, and I suspect it will hit all states, including Idaho, at some point. It's already impacting northern states. I think this is a tremendous tragedy that we're going to have young, healthy children die for something that is totally preventable. And but it is far from over.
So, Dr. Pate, how do you um, rein in an epidemic like this? I mean, and let's take the county in Texas where all of this started. The big issue was that they had, I believe, a less than 80% vaccination rate. And you need a higher vaccination rate than that to make sure that there is, herd immunity, right? So can you explain a little bit more about that and how that works? Because I think that there is, misinformation when it comes to, vaccines being safe and effective, right? Is that what
Right.
it's not like one person can just get vaccinated and then expect to be okay if no one else around them is vaccinated.
Right. So with measles, we are dealing with the most contagious virus that we are aware of. And so to help explain that, with if you have vulnerable people around someone who has measles, that one person with measles will infect 12 to 18 other people. Now, if you have lots of vulnerable, susceptible people, which we do across the United States, because you might look at some statewide levels and say, oh, they've got adequate levels of vaccine protection, but there are pockets in most states, and that's all you need
Mhm.
is for a kid to get in one of those pockets where there's a community that is very low on their vaccination. That's what happened last year in Ohio. It is Ohio overall had a satisfactory rate, but there were these pockets, and it just spreads like wildfire. So one child can infect up to 12 to 18 more people, and then, of course, each of those can then infect a similar number. And this virus is so contagious that if you are around someone with measles, you would expect 90% of the people exposed would become infected with measles. That's how transmissible it is. Plus, when we deal with things like schools or other public buildings, you can have someone with measles. They can leave the room. The virus can continue to circulate in the air for up to an hour or more, so that you then enter the room not thinking that there's any risk because there's nobody in the
Mhm.
room or that person's not there, and you can still get infected. So this is going to keep spreading. The way to stop we only have one way to stop an outbreak in its tracks. Either you get the MMR vaccine and get people protected by the vaccine, or the virus has to burn through all of these susceptible people. And of course, that's when we end up with people in the hospital and people dying, which is a terrible shame.
So, Dr. Pate, how concerned should parents, even frankly, even adults, who have been vaccinated with MMR, be right now? I mean, yes, this has not migrated to Idaho, but we've had those pockets that you've talked about, and we've had measles outbreaks in pockets in Idaho. So,
You're right.
I mean, where I'm just thinking about, parents in particular, right? Especially maybe with kids in daycare, school age kids, right? And you've gotten your
Right.
kiddos vaccinated.
Yep.
Are they okay?
Well, generally speaking, yes. Now, One dose of vaccine is 93% protective for life. But that means there's a 7% chance they won't be, that they still could get infected. If you get the two series of the MMR shots, that rate goes up to 97%. But still, if you had all vaccinated people, but there was someone with measles and exposed 100 people, 97 of them would be fine, wouldn't get the measles, but there will still be 3% that would get measles. Now, the difference is, having had the vaccine, to my knowledge, there are no cases of anyone they could get the measles, but they don't become severely ill and they don't die. So that's the benefit, even if they don't have that 100% protection. And so getting the MMR should be great protection for the vast majority of people. The exceptions would be people that are immunocompromised, either they didn't form a good response to the vaccine because of that immunocompromising condition, or they did, but later in life become immunocompromised with cancer treatments, steroids, those kinds of things. Those are exceptions, but generally, this is an extremely effective vaccine, one of the most effective vaccines we have.
Oh, really quickly, Dr. Pate, what about if you're a parent with a newborn? Because I think you can't get your first MMR vaccine until, is it 6 months old? So what should parents be doing right now if they're in that category?
This is a great area of concern to me, because generally we do not vaccinate until roughly 15 months of age.
Okay.
And so now, if this keeps on perpetuating and spreading the way it is, we do make exceptions and start vaccinating some children earlier, just because there's so much risk out there. We're not at that point yet, and we don't like to do it because they don't get as good of a lifetime protection as they do by waiting. That's why we do it at 15 months. However, these children that are very young are the ones who can be particularly critically ill when they get the measles. And the problem is that we've had numerous cases where children have contracted measles, or even adults. Actually, a lot of these cases are now occurring in adults who were not previously infected or vaccinated. Because remember, we pretty much wiped measles out in the United States back in 2000. So if you're a 25, 30-year-old and you weren't vaccinated, you also were unlikely to have ever had measles. And so you're going to be vulnerable. And it's these very young and the older that are particularly risk at severe complications. But you've got people that are contagious going through international airports, and you can expose large number of people that way. And this is not a U.S. phenomenon. Canada is having a particularly big outbreak in Ontario. It's just now spread to Alberta. We've got other countries having outbreaks. So if I had a toddler who was not yet vaccinated, I would be very concerned about international travel, taking my child out into large public areas, particularly in some of those communities or states that do have low vaccination rates.
We have a couple of minutes left, Dr. Payton. I want to talk about something that's going on in Oregon. There's and I don't know how to say it. I'm going to let you say it, but there are 3 cases of this pretty rare disease in Hood River County. Talk to us about this.
This was just shocking to me. So this disease, Creutzfeldt-Jakob disease, is a prion disease. So prions are abnormally folded proteins. And if you want to think about what a prion disease is, think back to the mad cow disease in cows. That is the analogous type of disease. It's very rare, occurs about 1 in a million people. The problem is that in Oregon, in Hood River County, you would project based on that population that they might have one case of this disease maybe every 20 or 40 years. They have had 3 cases in the past 8 months. That just about knocked me out of my chair. I've never even seen a case of this. And for them to have 3 cases in one county, 2 of those have already died. This disease is it's a progressive neurologic disease. It is uniformly fatal. And the problem is we've got to get an investigation done to figure out, wait, how would 3 people get this? And there's a lot of questions, but it's also a time when we have scaled down the CDC. Their investigative resources for new outbreaks are decreased. They've already had to turn down one state's request to help with a lead exposure investigation. I don't know if the CDC is going to be able to help in this. We need some answers. This is quite startling for this development.
Oh, what does that mean, Dr. Pate, for those of us in Idaho? Because I mean, Hood River County, it's Hood River, Oregon. It's outside of Portland. It's not that far away.
Correct. This is not transmitted person to person, so it doesn't. There's no reason for concern here. But we just need answers because, if it is related to a food source, we need to know that. Or if there's maybe these are, I think they would have told us if these are family members because there is a genetic component, but we haven't heard that. So we just need answers. But certainly, no Idahoans need to be concerned right now.
Well, with that said, as always, Dr. Pate, we so appreciate you taking the time to talk with us. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have public health questions for Dr. Pate, send us an email, idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.